Thank you for joining FreeCHiro's webinar. Today, we're just going to take a simple brief overview on how to utilize our system. We're going to do easy work functionalities. We're going to add a patient, schedule a patient, create a SOAP note, and also how to use our meaningful use and EHR functions. This will be a brief overview. If you want more detailed information, we do have training videos available to the public and to our clients. So today will just be a brief overview of our systems. So right now we are on the landing page. As you can see, I have different modules here on the top for telling me which kind of help resources I have. And I also have the venue options to the left-hand side. So if I want to address some help for the EHR, I just need to click on the EHR help, and I have different videos here on the red boxes with arrows that can play a video for me on how to do specific things. I can also click on the blue tab to help me access printed material for help resources to help me figure out what is needed. I also have this setting the stage area. So if I first signed up for my EHR, I need to disable pop-up blockers on Internet Explorer, Safari, and Chrome. Enable tab browsing for the ease of use. Using and setting a preferred browser for your system. And also learning how to increase the display size. We also have frequently asked questions that you can view by clicking on the computer icon to view a screenshot. Now, the first order of business is to add a patient. So I'm just going to click on this patient module on the left hand side, and this is my patient search area. Now I can type in the last name, so if I type in the last name Test, it will pull up all the patients I have in my system with the last name of Test. Now if I want to add a patient, I just click on this add button, and I can fill in the necessary information. So for this information, we're just going to fill in a test patient. We're going to call him Kevin Lee. We're going to do the date of birth for May 2nd, 1991. And we're going to say that he is a male. Now for meaningful use, one of the requirements is to fill out the demographics. So I'm going to fill out the preferred language. It will always default to English. I'm going to do the race and the ethnicity. I also need to select the rendering provider if I have multiple providers. And then I'm going to click Save. Now when I click Save, an MR number will be randomly generated, and this is a way for me to track my patient through an MR number. If I have a number that my office already uses to organize my patients, I can put that in the PC reference number, and that way I can search for patients using the PC reference number with a system that my practice already uses. So now that I've added this patient, next thing that we need to do is to schedule the patient. So I'm going to click on the Scheduler tab. As you can see, I already have people scheduled for today. Now to schedule a patient, all you need to do is click on an empty time slot for 11:30 a.m. I'm going to click on that time slot. I'm going to put in the last name of Lee. This will bring up all the patients that I have with the last name of Lee, but I'm going to choose Mr. Kevin Lee. And I'm going to put appointment reason. I'm going to say that he's a new patient. And if I want, I can also change the schedule status to new patient. I'm going to click save. And I can see that I have Kevin Lee here as a new patient in purple. Now I can change these configurations for my schedule status by clicking on the configure, and I can select a new status, I can choose a color, edit, etc. But right now I do have Kevin Lee, and he's going to be a new patient at 11:30. So after closing out of this, I'm going to go to the EHR Clinical Desktop, and this is the main area where I will access patient information. And as you can see, under my appointment tab, I do not see Kevin Lee. And that is because under the appointment tab, the defaulted area is confirmed and checked in. Now if I go down, I can see the different types, such as new patient. If I click on new patient, I can see that Kevin Lee is there. But if I want to view all my appointments, I just click on all, and I can see all the appointments that I have for today, Kevin Lee included. Now if I want to look for a patient that does not have an appointment, I just come to the patient tab. Again, search for the last name. I can search by first name, and also MR number or PC reference number. Going back to the Appointments tab, I'm going to click on Kevin Lee. And this brings us to our EHR chart. So in our EHR chart, it resembles that of a face sheet of a real paper chart. So here we're on the face sheet and it shows us the different values that we have. But because Mr. Kevin Lee is a brand new patient, his face sheet is empty. We also have different tabs at the bottom, including our document management. And this is a great tool that we use that runs off of Java. That if you are going completely from paper to EHR, you can actually scan and download documents onto your EHR chart so that the scanned document and paper chart will stay with the patient in their electronic medical record as well. We also have different tabs, including the order history, so you know what orders were ordered for this patient, whether it be prescriptions or labs. We have schedule history, so you can view the times and schedules that the patient came in, and this would be a great tool if you need to do it for workers' compensation or personal injury case or Medicare records. You can show exactly which schedule time they came and also the status as well as the checkout time. We also have visit history, so that you can view the SOAP notes that you did create. But because Kevin Lee again is a new patient, he has no past encounters. And if we go to current encounter, it'll tell us that we need to click on the encounter sheet box to select an encounter sheet and create a new encounter. So that's what we're going to do. The encounter sheet are basically different types of templates for your visit. So for example, a chiropractic examination will be like the initial examination and will have the most amount of information. The chiropractic daily note is similar to the chiropractic examination but has a lot of values missing from it that are not needed in a follow-up note. And we also have a chiropractic re-exam just in case there needs to be a re-exam option available. So for Kevin Lee, because he's a new patient, we're going to select chiropractic examination. We're going to select the service location and the date of service, and we're going to click on new encounter sheet. And clicking on new encounter sheet will bring us to our SOAP note generator. Please note that everything you see here is completely customizable through the level 1 and level 2 components. On the left hand side of the SOAP note generator, you can see our level 1 components are divided into the different SOAP note types plus additional areas. So I have an introduction area because I know some chiropractors like to have some sort of narrative before the SOAP note. I have the subjective area with necessary information like history of present illness, new patient intake, activities of daily living. We have the objective section, which will include different exams, the assessment section, which will take care of the diagnosis, and the plan section, which will take care of my CPT billing and my treatment plans for my patient. So we're going to click on introduction, click on the introduction here, and I'm just going to say patient came in for continued chiropractic care regarding lower back pain that the patient has been suffering for a month. Now, I can enter data through typing. I can also enter data through dictation devices and software such as Dragon Naturally Speaking. And you would have to access that program to learn more about data entry through dictation. I'm going to my subjective section. And I'm going to select on history of present illness. And here I'm brought to the history of present illness screen. So if I click on symptom 1, I can just say lower back pain. And I just type that in. If I have a date of symptom onset, I can click on this calendar chart to choose the date. So when I click on symptom date, I'm just going to click on May 2nd. And when I click on the third one, symptom result of, I can actually select the different types of level 2 rights that I have available. So I'm going to say that I don't know the cause, neither does the patient. She just said that she woke up one day and she started having these issues. Description of onset. I also have different values on the level 2 right and level 2 down. I can add values quite simply by clicking on the plus sign, putting in the name, and clicking save. I can do that the same for the level 2 right. And each value that I add will stick with the encounter sheet and will be applicable to all encounter sheets, regardless of who the patient is. So for description of onset, I'm just say patient woke up and was experiencing a sore back, no strange movement, and no strange positioning of lower spine. Frequently of symptoms, I could say that it happens once in a while, very occasionally. And the nature of symptoms, I'm just gonna say it's gonna be a dull ache and a numb, throbbing pain. Now I finished all my level 2 components and I want to go down. I can click on the level 1 and now I'm going to continue going down the list and filling out the necessary information. For meaningful use, the things that are required are allergies. So I'm going to say that this patient is allergic to codeine. Want to click on the current medication tab. This will launch our application with New Crop, in which I can actually search for drugs. So if I click on aspirin, I can search for aspirin and select the different types of drugs. One of the great things that we have that is required for meaningful use is drug allergy interaction. So if I type in codeine and do a drug search, it'll pull up the search, but if I select different ones, an alert will appear saying that this patient is allergic to codeine and the drug you are about to say that they take is something that they're allergic to. So I'm going to exit out and just say that this patient is taking that he's taking aspirin. We're going to click to select to move this to current medication so that it'll be recorded in our current medication tab. Another thing that's needed for meaningful use is smoking status. So I'm going to say that he's a never smoker. And please note that you can actually add any type of level 1 component you need. So for my practice, I do a lot of workers' compensation. So I have a workers' compensation questionnaire. All I need to do is click on the level 1s that I need to answer and fill in the different answers, whether by check mark or by typing in the values. I also have a diagram tool available, and I can upload my own images. Please note that our system does run off of Java, so getting the most updated version of Java will help ensure that our program runs smoothly. This is our diagram. I can choose a color pen and I can just circle, as well as type in notes. And have this information saved to the patient chart as well. I also have activities of daily living. I have different questionnaires available for pain questionnaires, etc. Please note that you can add anything you like. Our program is a way to just record notes. There's no correct way to use our program in regards of content. That is entirely up to the provider themselves on which content to add. We do so provide templates that give a general SOAP note of what chiropractors need. However, if you want to customize it, you personally can. You can add level 1s by clicking on this plus button to add a level 1. Select the SOAP type that you want it under and the name. And once you do, it'll be available for you to add level 2 components to as well. So again, I'm just going through very quickly, just a brief overview of our system. If I click on height, this is going to be in inches. I'm going to put 75. For weight, I'm going to put 200 pounds. And when I click on the BMI, it'll calculate automatically. And I'm going to record the blood pressure as well. Now the blood pressure, BMI, height, and weight are required to be recorded for meaningful use. So these are things that a chiropractor can measure as well. Now I also have different exams. If I click on the exams, I can see that I do have options available. If I don't see an option that I want or this workflow does not work for my practice, again, I can customize it. I can rename these to what I want it to say. So I'm just going to fill in different areas, as you can see. Very easy to do. I also added personally this X-ray report to my encounter sheet, and it's just a way to say X-ray findings show no hairline fractures or any recent damage to the bone of the spine. I'll just go to assessment. Please note that every time I just need to close this chart out, whether it be for timing out or I want to see another patient, if I click on the EHR clinical desktop, I can see that my patient Kevin Lee is automatically saved as pending. So I could just open it and resume from where I started. So I'm going to go to assessment, choose diagnosis, and go to these different areas. Now, a great thing to realize is that we have a repository button. So I am in the diagnosis area. If I don't know a diagnosis code but I want to add one, I can just type in the diagnosis code if I know it. Or I could put in the wording. So if I just say overweight, diagnosis code will show up. I click add. I click on cervical diagnosis 2 again. It'll be added to the area. Now, if I have a long list of diagnoses and I want to choose one, I'll just go in the search bar and click on the numbers and they will show up. Now, when selecting a diagnosis, please be sure to map D1 through D8 correctly. And I'm just adding random diagnosis to show how easy it is just to choose diagnosis codes. I can go to my phase of care if I want to do some recommendations, but I'm just going to go to plan. I'm just going to record my CPT billing. So I'm going to say that we're going to do a new patient exam because this patient is a new patient. I'm going to do level 3. And I have to match all the diagnosis codes associated with this patient. They do not have to be in order. I can also add modifiers by clicking on modifier 1 and just do GY, or I can do units and I can type in the necessary units. I can also go to radiology if I ordered some x-rays for them. I can do active therapy as well. And I can also set up my treatment plan saying that I want them to come in for manual therapy 5 times a week for 1 week. Electrotherapy maybe twice a week for 1 week. And ultrasound 1 time a week for 1 week. I go to patient education, state that I've given them education, and also I can upload my provider signature, which I'm going to add these. If I'm doing meaningful use, I can click on this MOU button alert system and it'll tell me that I do need to add patient education in order to fulfill this chart correctly for meaningful use. Go to the patient education section, click on patient education provided, yes, and then I'm going to view my narrative just so I know exactly what my chart looks like. When I click on the narrative, all the fields that I want will be included, including the address, the service date, the patient, etc., as well as a SOAP note that I have created. So I see that this chart is to my liking, so I'm going to save this chart as complete. And this chart is saved as complete. I do have a core objective reminder saying that I do need to print out a CCR, clinical summary report, and hand a copy to the patient. I need to do this for at least 50% of my office visits. So if I click on this printer icon and click on this PDF icon, I will be counted for that. Even if the patient does not want his clinical summary, I am able to provide it for him. So I'm going to close out of this. I have finished with my chart. If I click on clinical desktop, I can see that Kevin Lee has disappeared because his chart is now complete. And if I go to the charges tab, I can see that under enter charges, if I click on Mr. Kevin Lee, all the diagnosis codes that I entered, as long as the diagnosis and CPT codes, have already been modified and entered, and the billing is ready to go. And that's a great way of how our EHR system works with our billing system. We have one system integrated so that the doctor can create the note, have the CPT codes available in the chart, and the billing will already be updated. So that way there's no miscommunication between the front office and billing with the provider, and it also saves a lot of time. Now we're going to talk a little bit about our meaningful use reporting. So if I go under EHR Advanced and I go to MOU reporting, I'm brought to this area where I can actually view and see if I've been compliant with meaningful use. So if I do for the week to date and generate my meaningful use report, I can see that a lot of the values I have are not really posting the way that I should. For meaningful use, chiropractors are exempt from number 1 and number 4 because you guys do not prescribe medications. And I can learn a lot about these different types of core objectives by clicking on this help tutorial video. If I click on it, a video will pop up that I can watch and be informed of the core objective. Now, if I want to read more text and a more in-depth explanation, I will go to the help and guidance link on meaningful use. And this will bring me to a help resource chart. Now, it tells me that EPs must meet all core objectives. Again, chiropractors are exempt from number 1 and number 4. It tells me the objective description, how this objective is fulfilled in Practice Suite, how it's calculated in meaningful use, and how it's applied to me as a provider, and the steps I need to take in order to fulfill this. So for example, if I go to number 13, provide clinical summaries for patients for each office visit. What do I need to do? You will need to print and give the generated clinical summary to each patient after their office visit. Please note that this is not for every encounter, but specifically for office visits. The option to print this report is available after you complete an encounter. We also have help resources to help you with some of the criteria that you need a third party for. For example, number 15, protect electronic health information created or maintained by the certified EHR technology through the implementation of appropriate technical capabilities. This link will actually bring you to a website that can help you review your security risk analysis in accordance with step 4. If you click on that, you'll be able to view and do the necessary information that you need. Now, please note that when you do apply for attestation for meaningful use, you'll be asked these questions and you can just simply put in yes or no. Or if you have a value such as a percentage value, you can upload that information through the website. We also have menu objectives, and it states that eligible providers must complete 4 out of the 5 menu objectives. And I do suggest reading over this to see which objective your practice can accomplish without any additional workload. We do have some recommendations, such as number 3, generate lists of patients by specific conditions to use for quality improvement, reduction of disparities, research or outreach. And we do say that you must print at least one patient care analysis report, print and sign the general report to keep as documentation for attestation. This is a very straightforward criteria to meet, and therefore EP should choose this objective. So we do have recommendations. We do have recommendations to also exclude objectives just because some of them may be very specific to the type of practice that you run. Also, when applying for certification and attestation, you do need our certification ID for EHR, and that link is brought here, and you can see our CMS EHR certification ID, as well as our product number and vendor name. Please also note that there were a lot of criteria that is set by the federal government that Practice Suite had to follow in order to be certified. And that concludes a brief overview of how to use our program, how to generate a SOAP note, how to enter a patient, and how to schedule them. We do encourage you to continue to play around with our software. We do believe that experience with our software will enable you to use your software more effectively. The learning curve is a little steep, however, once you have grabbed the necessary basics of our software, the software will only work more beneficially for you. Thank you very much and continue to use our program.